Hi, everyone. Welcome, excuse me, to our program today. My name is Heather Law, and I apologize as I have a slightly hoarse voice, but I would not let that stop me because I'm so excited about our program today on community-based healthcare innovation, breaking barriers and building solutions. So we are so excited to be bringing this program to you with our wonderful colleagues and this is through a partnership with alumni engagement as well as the Center for Healthcare at Tuck. And we have a distinguished alumni joining us as well. Before we do the introductions, we just want to say thank you for being a part of this program. It is actually a part of the 125th anniversary of Tuck, where all year long we've been providing programming both in person and virtually to help celebrate Tuck as well as help you all and your professional development. We would love to get a sense as to who is in the audience. So please, in the chat, share with everyone where you are hailing from, as well as what year you are. If you are a Tucky, we would love to just get a sense as to who is with us today. This meeting or webinar will be recorded, so please know that you'll be able to find this and all other virtual programs we've conducted on the MyTuck website in our video archives. And any questions you have, please put them in the Q&A box. We will be asking them at the end of the program. So again, we are so happy to have you here today, and I'm honored to be joined by Lindsey Leininger, who is a faculty director for the Center of Healthcare here at Tuck, as well as Tuck alum Courtney Bragg. And with that, I'm going to hand it over to Lindsey to do some wonderful introductions. Thank you for being here, both of you. We are so grateful.
Thank you so much, Heather. And thank you all for being here today in our Zoom classroom, if you will. We really appreciate your engagement with Tuck and your willingness to join us today for this really what I hope to be fun conversation. As Heather mentioned, I'm Lindsey Leininger. I'm the faculty director of Tuck Center for Healthcare. Along with my colleagues, Melania Laverick and Susie Rubin, I lead the center. Our mission is to foster learning and connection among Tuck community members interested in healthcare. We do that through providing co-curricular activities, industry and alumni engagement, like our conversation today, and cross-campus partnerships with other Dartmouth members interested in healthcare. If you're interested in learning more about us, you can find us on LinkedIn, the Tuck Healthcare Network. You can find out what we're doing and how to engage. So our conversation today, turning to our time with Courtney, it's focused on community-based approaches to tackling what we health policy wonks call the iron triangle of healthcare, the seemingly impossible task of simultaneously improving access to care, ensuring quality of care, and lowering the cost of care. We are unbelievably grateful to have with us today Courtney Bragg T’18, who's confronting this iron triangle head on by moving beyond the four walls of the clinic and bringing people services they need in the community. Her company, Fabric Health, brings healthcare and social services to people where they already are, at the laundromat, turning a weekly chore into an opportunity for improved health. So without further ado, I want to offer a warm welcome, a huge thanks to Courtney, and to ask you to share a little bit about yourself and your story and your journey from Tuck MBA student to healthcare entrepreneur.
Yeah, absolutely. Thanks so much for having me, Lindsay, and everyone. I am originally a Florida kid, so my journey to Tuck was cold, as we were just talking about, as there's snow on the ground. But my background before Tuck was in education, and so I was an urban studies and education major. I think I very pointedly said in college, I didn't want to make old rich white men richer, and then left the business school as an undergrad, and spent many years in urban education beforehand, and got deeply interested in that time working in Southeast DC in the analogs between healthcare and education. So every time that a kid gets hurt, which children do a lot during the school day, I learned, an administrator would be in the ambulance with them and ride along. And so I spent a lot of time at Southeast Children's Medical Center in Anacostia, DC. And it was just, I would see like half a dozen kids in kit polos on some days when I was there. And I just got really interested and really frustrated by this other massive federal spend, really disparate outcomes. And this industry I knew nothing about. And so my background, again, like first and foremost is education, but then coming to Tuck, I really, you know, as a had a conversation with like my younger idealistic silly self of like, oh, maybe there actually is value in models that have profit and how things work, et cetera. But I came to Tuck because working in education, and KIPP is a network of charter schools that I have a lot of respect for and came from and everything. In DC, it was massive, right? Like we were at, I think 15 schools at the time, employed like 700 teachers. Like it was this hundreds of millions of dollars organization, and very few people in the organization, including me, knew anything about the actual operations of the organization. Like we knew a ton about children, we knew a ton about families, which like arguably is the most important thing for education. But it felt like there was this whole piece that I didn't understand about the world. And in the same way that I grew up in South Florida and I can properly cuss you out on 95 if you've cut me off in traffic in Spanish, that I wanted to have a basic proficiency and understanding of the world of business and finance and accounting, quite frankly, because I just didn't get it. So I, as a former educator, was very focused on the classroom, and so I focused very much on asking every MBA program. I looked at a series of 5 questions that were the same, and one of the questions I asked is like, what is under leveraged here? And a couple of the programs told me the education, and that didn't quite sit right with me. And then I went to Tuck and ironically like really enjoyed that you were cold called. Didn't love it on the other side, but like just loved that people were intentional and present and everything else. And so I kind of fumbled my way through my 2 years and said yes to a lot of stuff, terrible at hockey, tripod, or anything else. Turns out Florida kids just cannot skate. And I knew nothing about entrepreneurship or anything else, but I'm a little bit fundamentally unmanageable because I'm not great at staying in a lane and not solving problems or asking why couldn't we do it this way or like why did something work this way. And so very much started to find my feet under me more in the healthcare space at Tuck, and like very, very excited for everything that is happening with the center and everything else. And think it's just such an awesome asset for newer Tuckies and for alums. But I think for me, it was not this idea of starting a fabric or starting something. I just really like solving gnarly challenges and very consistently with poor families because those are the families that I've been privileged to spend most of my career working with. And so kind of haphazardly, kind of intentionally wandered into healthcare startups.
I love, there's a lot to unpack there. But the Florida kid on skates at tripod is kind of that's a great little tug nugget for you right there. Okay, so let's pivot. Let's actually talk about fabric health. You're doing something really innovative here. You're alchemizing a weekly chore into an opportunity for people to actually feel cared for. I'm a very time-strapped working mom, and I really appreciate the value in this approach, right? You're respecting people's time. Where did this idea come from, and how and when did you know it had legs?
I mean, ironically, a really top investor told me like you only know product market fit in the rear view mirror. Like, right, like there's this idea, and this is a top Valley investor. And I was like, oh, how do you know when you have this mythical thing? And it's like, I don't know. I have a lot of respect for business school and case studies, but like you don't. Like you don't know that you have something real. Like you think, you hope. We had all sorts of like initial indicators of like, my co-founder and I, are we going to double down on this? Like when are we going to burn the ships and be like, this is something we're going to pursue? And I can talk more about like those early founding days because they're really freaking hard. And they're also really fun. Like it's just um it's wet clay, like all of it. You don't know how to do anything and you have to learn so rapidly, like how to very, very simple things like how to open a bank account, how to get insurance, like all of those things are suddenly things that you have to learn up very quickly on. But yeah, the laundromat fundamentally comes from my days in Southeast DC, right? Like life looks really, really different for poor families. And I am from an upper middle class family. My dad went to 6 different colleges and lived in his car where he could get construction jobs. I did not, right? Like my parents worked really, really hard. I had scholarships, like I was able to go to great institutions and everything else, but like I am not from a working class family. But I've spent a lot of time, as I say, earning my spot at the cookout, and working in predominantly Black urban communities. And my kids would come from the corner store in the morning. They'd get off the subway and we'd drive or escort them back to the subway station in the afternoon because it was the most dangerous part of the day, right? Like you always swept the building and you made sure that everyone had a safe ride home and a way to, because in Southeast you would walk down the hill and you'd walk through five warring housing projects and you'd get jumped because like we were on an extended day and an extended year. And so there were very different beats about how my kids and their families lived their lives. And mom was at the laundromat on Sunday, right? Like, so when I did a college boot camp for my kids' parents, because DC is the only city without a state university system supporting it, which was a fun thing to really understand and tap into when I moved to DC. There were these things and these rhythms that like work so differently for my families. And the laundromat was a piece of that, right? So like when exactly I can tell you like, you know, the sanitized version of the laundromat and the origin story and all of those things, but like it just it's a poverty tax, right? Like I don't think about doing my laundry in the same way. It's still a pain. I still don't enjoy it, but like my my laundry machine is 800 feet from me. It's not the same kind of thing. And fabric families spend $15 to do a large load of laundry on a weekly basis. And so when you think about families that are making minimum wage, that are working class, et cetera, like it's a lot of time, 2 hours every single week that you have to go to the laundromat. Um, there are 30,000 laundromats across the country serving 32 million Americans. And it's really expensive, both in terms of that time and that direct cost. And so that was deeply interesting to my co-founder and to me, who come from different paths into the work at Fabric. The laundromat is still the single best brick and mortar distribution channel I've ever found. Like, I don't think there is something better. And to give you a sense of scale, I give you a little bit of sense of price of just like how hard life is if you are a poor mom, making it from a shift to pick up the kids and everything. Um, but the scale of these organizations, and they do function as these de facto community centers, is our largest laundromat in Northeast Philadelphia will serve 8,000 families a month. And like that throughput was just really, really interesting to us. And so we had no idea what it was, quite honestly. I thought it was healthcare plus laundromats, but like beyond that, it's not really compelling. Like that's healthcare plus laundromats. Like it's like an anagram, you're starting to play, but it's not actually like a business model. But I couldn't put that down. And that was really interesting to me. And today, like the laundromat is still the nucleus, but like we were at a food bank the other week and 150 out of 150 families were like, we need help. And we had an federally qualified health center, which is essentially like the most safety net of the most safety net in healthcare, right? These are federally funded health centers that see you whether you're insured or not insured. And so there are lots of undocumented families that it's the only place that they can get care, period. But there are a lot of people who are coming through, and it's like we had 40 referrals from a federally qualified health center partner last week, and 76% of them converted to services. And so while the laundromat is really important, what we found is like there are all of these nodes and all of these places and pathways to Fabric where people just need help.
Thanks. So I'm going to pull on this thread a little bit and talk about the services. You just mentioned that the FQHCs were a referral to services. So can you tell us a little more about the service you provide and what the business fundamentals are? Because I think it's maybe for those of people who aren't in the healthcare safety net like you and I are, it's not obvious why this is a business as opposed to a nonprofit.
It's not obvious to anyone ever. I mean, like anything in Medicaid, I would say is not obvious. So to back up a little bit on a period is like there, and for some of you this will be like very very rudimentary, and some of you will be like, oh, um, I did not understand any of this before I started working in the space. Like, eh, there's Medicaid, which serves 80 million, 90 million people and decreasing for various policy reasons today. And that is, I always say, we aid poor people, we care about old people. So Medicare is the other side of the government program, which is for 65 plus or people who are highly disabled and need much more wraparound support. That is a big chunk of the US healthcare system. And then you add in the another like 30 plus million and decreasing for other reasons in the Affordable Care Act in the marketplace. Like the government insurance kind of wrapper is huge. And it's providing a whole lot of care for a lot of people. And so fundamentally for us, um, I did not want to start a nonprofit because foundations are fickle buyers. So I fundamentally wanted to start something that you could build a business in and that our profitability would be predicated on our impact. Because I think anytime you try to do these social impact and these mythical like social impact investors, like anytime that there's a trade-off, it doesn't work. And so to me, it very clearly had to be whatever I was selling, and I felt much more comfortable selling, which is like a whole other question of why someone who has no sales background felt like they could sell something. I felt like that just made intuitively more sense to me than a nonprofit. And so we incorporated as a public benefit corporation. We're like explicitly day one in our mission is to improve the health and well-being of underserved communities. Um, some of that's virtue signaling and like structure and stuff, but it was important to us to like do certain things in a certain way and be like, how are all of the ways that the fabric model could be perverted? So like we talked to some early investors who were like, the data you are sitting on. And I was like, so nice to meet you. Like, good day. Um,
Although I
for
said
also,
that to you too.
no, for sure. But like this was a like,
Get
how do you
commercial.
repackage it in like
Not how do you
shady
learn from
ways?
it to improve your
Yeah, it
service.
was like, and I'm like, I will close fabric before we sell to payday lenders or, all sorts of other folks. But it was just really important to me that our profitability was predicated on our impact, and building a Medicaid first business is stupid. It is like it is a
I'm a Medicaid
low
researcher, so I'm laughing with understanding.
It is a low margin business. It is the redheaded stepchild for a reason. Every state and entity has its own Medicaid system. So every Medicaid policy person, including you, Lindsey, will say, one Medicaid system, one state. And there are 56 of them because we also have DC and territories. And so like it is just mind-numbingly complex for a lot less money and a lot less reward than Medicare. Um, and so I think like there's still this open question for any startup and definitely for us of like, can we weather the storm and how successful is it? But like we have some proof points and things that are working. So right, there is on average about 25% of Medicaid churn every year. So Medicaid, because it is for poor families, is a means-based program. I will very much argue that it is a pretty mean program and that like we intentionally don't want people to be on Medicaid. We make it very, very hard to get Medicaid and we make it very, very hard to stay on Medicaid. There are a million trapdoors that people fall through all of the time. And some policy changes recently have made that harder. And what they found when like they've done all of the research, which like Lindsey has done this research and everything else, is like it doesn't make the program work better. It doesn't make it cheaper. It actually just makes everything harder and more expensive. And it's death by paper cuts and everything. But those paper cuts are really, really real. And so for these 90 million people who are eligible for Medicaid, a quarter of them tend to lose coverage every year. And that's because, again, it's really hard to lose. It's really hard to keep coverage. And there are a million reasons for that. And I'm happy to get into like what those are. But our first thing and the necessary but insufficient first part is like get and keep people insured, which is really hard. So we start with that. Um, we are doing things like SNAP applications. One in terms of, sorry, SNAP is food stamps. And the program
Also
that
news.
also in the news. Yeah, my business has a lot of news coverage these days, which I wish it didn't. But yeah, there are 42 million Americans, and again, decreasing because of policy reasons, that are eligible for about $6 a day on average, I believe it is, in food benefits. And so we'll do a SNAP application as well, not only because you can't really think about your healthcare if you're rationing food, but also because what we have found in mapping Medicaid is if you don't recertify for SNAP, which happens on a 6-month interval, not a 12-month interval, as Medicaid, as what it will show up for the state is that you did not certify your income, and a Medicaid lapse will often follow. And so they're just like in the kind of trapdoors we were talking about, it's like it's those kinds of things as like the starting point to get and keep people insured. But then I want you to actually use your insurance. And no one, including me, who has whatever kind of Cadillac insurance, knows what their insurance avails them of. And so we often are seeing pregnant women long before anyone in the healthcare system knows that they're pregnant. We are seeing unvaccinated children. Like we are seeing all of these like health problems that are just quite frankly not the urgent problem, or someone has given up or like just been defeated about actually being able to address. And so I always talk about fabric in this kind of short term, in this heuristic of like it's got to be muffins before mammograms. So we have to solve the urgent problem first, and we build trust there to do the important healthcare work that no one wants to do. Like I got blood drawn yesterday. It was terrible. I've been putting it off for how long? Like no one wants to interact with the healthcare system because it sucks and it's not fun, even if it's going well.
So these government insurers or these managed care plans that serve Medicaid and some Medicare populations are your revenue stream, correct? Like they pay so that you can engage their patient so they can hit their KPIs with the government. Is that right?
Yeah, so basically, fundamentally, plans are our first customer and dominant customer. We're increasingly working with providers and other vendors and people in the space because anyone who has worked with health plans know how slow and bureaucratic they are. And so even if you are like, I have this high-risk pregnant woman, which is like the most expensive thing that will bear out in the Medicaid rolls once claims data comes through because it's a NICU visit, like it is still hard to get that woman to timely prenatal care and avoid that NICU stay and stuff. So like we're doing more of the wraparound with other folks too. But like a health plan fundamentally, and particularly in Medicaid, needs to grow and retain their members, right? Like that's how essentially they're getting premium in. But at the end of the year, they have these quality measures that they have to hit. And so to actually get the full amount that they could make, either from CMS at the federal level for Medicare or at the state level for Medicaid, they have either these quality measures that are bonused or they're actually penalized for. And so they have this incentive to not only get the person, and this is always where it's like the common thing is, well, like, don't they want to ration care in certain things? And like, yes, maybe, but also they want to earn into the full amount of revenue they could earn. So like there is an incentive to have this longitudinal engagement.
Yeah, and the states care about this. So just an anecdotal point, I did some work for the state of Wisconsin earlier in my career, writing the contracts around these quality bonuses, right? So they would like getting kids into well child visits or vaccines. This was back when vaccines were not quite so sticky, and the state would bonus or penalize the managed care plans on that. And the managed care plans are great at a lot of things, but I think finding and engaging patients is not typically their bailiwicks. So they need your services. And I come from a public payer background, so I say that with love as someone also who probably wouldn't be very good at what you do. So, this was a question from the audience that we got submitted early. What is the like most surprising or unexpected thing that you've learned from your work in fabric and spending time in laundromats doing this healthcare engagement?
I don't know that I have a great answer. I'll pick two things that just came to mind of convenience. One, we had this question early on of like, how does this scale? And it's a very, very fair question. And like, does this work in North and West Philadelphia where we were started? But like, does it work in Dallas? Like, does it work? I was picking on Dallas before because Lindsey's from there. But does it work in a different context? Does it work in a different policy context? Does it work in a different demographic context? Like, does it work urban, rural, etc.? And so we tested that pretty early on by intentionally making our second expansion to be in Southwest Pennsylvania. Like, if you know Pennsylvania, it's a fascinating state. And I say that with all of the love and as a diehard Eagles fan now. Go Birds. But Pennsylvania is interesting because the two big metros, right, are Philly and Pittsburgh. And they could not be more different, like in every way, like socioeconomically, demographically, like size of city, the healthcare market is radically different. Um, and so we wanted to basically break it. Like we wanted to go somewhere where we would have the same state, right? Because Medicaid state's hard. Um, it's much easier for us to do the same work. Again, if you're familiar with Philly at all, it's much easier for us to do the same work in Scranton than it is for us to do the same work in Cherry Hill.
Yeah.
Even though like Cherry Hill is in New Jersey and a Philadelphia suburb for all intents and purposes. Um, and so we wanted to go somewhere really, really different, but that we weren't starting the policy context over again. And everyone was like, oh, it's going to be so different. And it was not at all different, right? Like very urban North Philadelphia, highly scammed, predominantly Black American population versus like post-industry steel worker union town, predominantly white, much more rural. Like we are in Greensburg, Pennsylvania. That is not a metropolis of anything. It is a small town, and people have the same fundamental questions and concerns, and you just don't do things differently. Like people have different ways they talk about things. We say Obamacare in Philly. We do not say Obamacare in Pittsburgh. People in Philly will say welfare insurance. You would never say welfare insurance in Pittsburgh. But other than like disagreements around pizza and football teams, like it is exactly the same thing. And we have found that whether we are in Maryland, whether we are in rural Illinois, like people are people and everyone is trying to get through the day and get through the month. And so I think like there was this perspective in like, well, does this actually work in a rural population? Or like, this is a Black American intervention, or this only works for moms and like this kind of way. And it's like, turns out it's really hard to be poor and it's really hard to use your healthcare. And so we found pretty early on that there's very little difference there. Like people want things to be easier. They want to trust people. Like they want things to work, and most things don't. So when you do what you say you're going to do and like continue to act on that and are an honest broker, like people are pretty receptive and pretty great. I would say on the other side is like I didn't really know what fabric was, but everyone kept telling me engagement was really important. And everyone told me like I'll give you actually a real example here. We do reporting to our customers on a regular basis. We send them, and why it's monthly is mostly because healthcare IT is non-existent. So it is often like sending them in a secure Excel file through a secure portal. Like, yes, it should all be like APIs in real time, but that requires healthcare, working in any kind of technical way. And when we sent an early data file to one of our Medicaid plans, they said 95% of the contact information we sent to them was new to them. And so it's like every plan benefit decision they made. And like a lot of these places are making billion-dollar benefit decisions of like getting this diabetes program, doing this thing. Like they have all of these things for all of these diseases, for all of these different populations. Like, well, if 95% of your contact information is wrong, your hit rate of who could use any one of those benefits is pretty damn low. I've not been able to sell contact information in 5 years at Fabric Health. It's not anyone's KPI. Everyone knows it's a problem. Everyone knows engagement is this $1 trillion problem in healthcare. No one actually pays for it. It's no one's bonus. The system is incredibly reactive. And so, like, one of the things I wish I had done earlier on was just like, what are the very, very clear financial incentives? Like, I don't need to boil the ocean and change every paradigm. How
Right.
do I more clearly, like, check the damn box?
So, it's funny because one of my questions was like, what would you tell earlier, Courtney? And I think you've already answered that one. So
Yeah, I'd yell at her about that.
that's great. So, that you would tell earlier, Courtney, to, align with kind of well-grooved financial paths a little bit earlier. So I'm going to stick with the entrepreneurship theme here for a minute. And I hope y'all will excuse the laundry metaphor in this question. Courtney's co-founder, Alistair, has wonderful laundry metaphors. So this is in spirit of Alistair. Okay, so the entrepreneurship path is not a smooth cycle. More often it's rinse, repeat, and the occasional spin out. Thought that was pretty clever. Tell us about some of the unique joys and headaches you've experienced in your 5+ years as an entrepreneur.
Um, I I am drawn to organize chaos. Like, I really love building. Like, I do. And I think there's just something, I think we have this weird cult of the founder thing that has been happening in the last, like, probably, I don't know, like 15 years or something in the US. And it's this, like, I don't know, bizarre grind 996, like, down for the cause, everyone's going to be a billionaire. Like, it's absurd. But I just could not put down this insight. And, like, I kept picking it back up of, like, what would this weird laundromat healthcare thing be? Like, I quite frankly, like, did not leave Tuck like wanting to found something. I didn't think I would found something. But I work with exceptional people. And I work with exceptional people solving a really, really hard problem. And, like, that's not a glory thing. That's not an anything else thing. But, like, we support about 40,000 families today that have opted into Fabric. And life would fundamentally be worse for them if we were gone tomorrow. And, like, that's just really, really hard and really gratifying and really fun work. Like, it is it is using my brain in a way that, like, sure, some things are rinse and repeat. Um, but it's like it's the most mentally taxing and interesting work that I think I could be doing right now, much less, like, I really care about it. And so that's just, most of us don't get to spend our time doing that. And I'm just like, I'm very grateful to be able to do that.
So can we talk more about this entrepreneur grind culture that we see a lot on LinkedIn and other socials?
Well, everything on LinkedIn is fake, so
Right.
that's where we should just start.
Although this seems to be real, perhaps.
Yeah.
So what have you found? Like, what strategies have you found to be kind of personally protective in terms of entrepreneurial well-being? I mean, both for yourself, but also your team, right? Because when you're a founder, you're worried about your own well-being, but also you have a team who's working really hard,
Yeah.
worried about protecting their
So
well-being.
don't found something where the busiest days of the week are Saturday and Sunday would be where I would advise someone to not do. So Saturdays and Sundays do the same volume of business at a laundromat as the rest of the week. So the fact that, like, people are coming to us from other capacities is great for my sanity. But it's really, really hard to turn off. And it's like, I woke up at 4 a.m. thinking about a customer problem this morning. And I
Mm.
don't know how to turn that off. I deeply wish I could. Like, my therapist says that I talk about, like, going to sleep as if I'm powering down, as if I'm a computer. And she's like, that's not how this works. And it would be great if it was. Like, I wish I could just, like, turn off and turn on, because I think it's much healthier. I think, like, the grind bullshit is total bullshit. I mean, like, being a founder is incredibly hard, but you can also be, like, a founder who wants to just fail up, right? Like, you want to get a glossy magazine cover and then, like, say you were a founder and get another job. Like, that is a path that a lot of people take, and that's fair and fine. And it's like, you're burning some VC's money and it, like, works or it doesn't or whatever, but, like, we we made this really hard on ourselves, like, and tried to do like no one was looking for a Medicaid business hanging out in laundromats. Like that is not an investor's dream. And so we try to be really intentional about some proof points that like fabric could work and was needed, which is not how most people build a startup. And so that's fair and fine, but I just think like I'm not the best model because I'm not, I just told you I woke up at 4 a.m. Like I wish I was better at it. We close for the week of Christmas into New Year's. And it's just like, I don't want to see anyone. Like, no one talk to whomever. Um, I never want, we have a lot of people on our team with kids. Like, please don't tell me you're signing off for a half day because your kid got sick or whatever else and apologize and say you're gonna like make something up. Like, go to your kid's soccer game. Like, do the things. I think that's the only way you can actually build anything that's sustainable. Um, and I just like, I very much have my team's back. So, like, my head of sales is taking her first vacation away from her children in 7 years. And she was like, I'll be in London tomorrow, but I'll have my computer. And I was like, don't, like, I didn't ask you to. I'm not going to reach out. But like, I'm seeing if I can get scones delivered to her room, right?
Oh,
Like, there's just like, how do you show up for people? And it's like a handwritten card. It's like actually doing something. It's like, she is very nervous about like signing off tonight. And I'm like, bye, like, enjoy. Um, so again, I need to be way better at those things, but I think a lot of it's just like I was being flippant, but like it's incredibly performative.
yeah. Okay, so I'm going to ask one last question before we'll turn it over to the audience. All right, one more laundry pun because I can't help myself. Let's spin the cycle forward 10 years. Fabric Health is successful beyond your wildest dreams.
Great.
What specifically does that success look like to you?
I think that fundamentally means life is easier and better and healthier for millions of families.
Hmm.
I think like it truly is like, again, that's a very big business, and I have no shame in that being a really big business and like sleeping for, I don't know, a month on a boat or whatever that is. I would be so sick, seasick, but I think it is there is a way like our system doesn't have to be this complicated and difficult. Like it is an incentive problem and it is an admin problem. And it's like, I actually believe there's a lot of fraud, waste, and abuse in healthcare, just not from the families. Like ours, like US healthcare is a massive business. And so it's making that system fundamentally work better where the incentives are aligned for families and the system actually is doing well, and I'm really okay with that. Like I would love for there to be all of these nodes into Fabric, and we talk about laundromats as an origin story, but it's like a sweet little origin story because like Fabric just makes your life easier and it runs in the background. And that sounds pretty great to me.
I'm going to dream that dream with you, Courtney.
Right?
Um, so I'm going to turn it over now back to Heather. And I know we have some great questions from our audience members. Thank you for submitting those. And Heather, back to you.
Yes, thank you. And Lindsay, I really appreciate the puns. So thank you for your work on those because they do add a little color. So I appreciate it. Thank you. Courtney, this is so helpful and fabulous. Excuse me. So great questions have come in. Can you talk a little bit more about how you define success and what your metrics look like? So basically, the audience member is really curious about how your services are scaled, and is there a role for the local health system to continue to advance delivery of services to the patient?
The local health system in terms of like a health department, in terms of a hospital.
Let's go with, yeah, the local health system with hospitals.
Um, So yeah, I think hospitals have a big role to play in this in systems. And I think like some of the things the ACA has tried to do is like think about where those incentives align. Not surprisingly, it's led to a lot more consolidation. So that the folks who own it just own a bigger piece of it. But I think like uncompensated care is a really natural incentive driver for a hospital, right? Um, Everyone should have an incentive for someone to not show up uninsured at the emergency department. And like the emergency department is rarely the place you want anyone to show up. But assuming that they are showing up, like you certainly don't want them to be uninsured. So like Medicaid is our most efficient like health program in this country. Like Medicaid's efficiency is insane bar none. Like it is just pennies on the dollar of what we spend for anything else. And in some ways, it's great coverage. Like the networks are really narrow because it's really hard, again, to make money in Medicaid. So that's a fundamental problem. Um, but I think it's really interesting because there's just this efficiency. And so it's like Medicaid is incredibly important for our healthcare system to work writ large. And I think health systems, and I'll talk about providers, healthcare providers writ large, they like to be paid. They don't really like to pay for things. They're kind of like, I receive money and you show up to my office and then I activate. And I think there's just a really, really lost opportunity of like these health systems are absorbing all of these patients, compensated or not. And so like they have a lot more incentive to be proactive in families being insured and using the right level of care, et cetera, et cetera. And so I think there's actually a lot there. I think it's really hard to get them to part with dollars and to make investments.
And this is really, do you find a big resistance to healthcare providers wanting to work with your business as a third party?
I think they just want it to be free. So like that's a minor problem. But I think there's some who have literally been like, can we share revenue on this? Because like we don't know what to do. Like I was talking to a healthcare system with 17 hospitals the other day, and they're like, we go door to door when someone is admitted and try to help them apply for Medicaid and then like cross our fingers. And I was like, so what's the volume of people you're doing that with? Because that's insane. And two, like, how many of those actually ever convert to compensated care? But they don't know. And so I'm like, you're doing this crazy amount of work, literally knocking when someone has been admitted to the ED. And then, like, to complete a Medicaid application, you need pay stubs. I imagine someone's not like, oh, let me log into my system right now and like get you my pay stub. So my guess is like none of those applications are ever completed. And the hospital's holding the bag on that care. And like no one has the incentive for that to be happening. So I think there is an incredible opportunity with with providers. But I think it's hard because again, I think it's a paradigm shift of like, well, why would I pay for something or why would I engage here?
Are you collecting data on how people are working and engaging with the ED? With this person, its example is the Oregon Medicaid experiment has showed an increase in ED usage. And is your team seeing the same trends?
So we need to see claims data and everything information in healthcare that is fun and challenging. But I mean, Lindsay, I don't know if I told you this. We did some like look back over the summer, and for one of our partners, we looked at, I mean, not a ton of people, but we were basically looking at, I had this hypothesis that the summer was a great time to schedule back to school physicals. And that was a really logical way to get engage with mom before she's thinking about the thing, right? Like you got to get the child's visit done, but like if it is June, you are like, oh my God, August, September is so far away. Like it's just like it's not at all on your horizon to do that because you're trying to survive like the summer with kids at home, et cetera. And so we thought that was going to make a lot of sense and be really, really like complementary to fabric. So we started looking at kids that had well child visit needs. And the idea was, all right, like make these pediatric calls. One, it was interesting because it didn't seem to matter seasonally at all, which didn't make sense to me. But like, great, we found the data that like it wasn't more acute in the summer. But we started making these calls and we had parents who were like, could you help me? Like, I should probably go to the doctor. And then we started seeing all of these gaps, right? Like, oh my God, you've got all of this going on. And so for two people that we engaged, there were 80 plus ED visits among the two of them. And one of them had 24, 27, I can't remember. I don't know that it's really material at that point, whether it was 24 or 27, was a 17-year-old who was pregnant. And we had met her. No one in her family knew she was pregnant. She hadn't acknowledged it to anyone but us. She had been to the ED 24 or 27 times. And that is absolutely like I could talk to any actuary in the world who is like, that is a patient who costs the system hundreds of thousands of dollars. She's pregnant. That is a NICU stay. Like, without a doubt. Like, we just know. Like, there's no coding, there's no analysis that needs to be done. Like, it's a very, very expensive, like very dangerous patient for the system in terms of cost, but like something is wrong. Like something is fundamentally deeply wrong. We did this superhuman work to get her into timely maternal care. She delivered a healthy baby, which is like math that does not math because that should not happen based on that track record. And then her son went to his 2-month visit and got his vaccines. Like that is a public health, that is a provider's dream, that is a plan's dream. Like that is like the iron triangle becomes a marshmallow. I don't know. Like it's a totally different thing. But the reality is like Fabric cannot do those heroics. Like we didn't make any more money on that. That for us was a case study of what's possible. But I'm like, someone should have bought me a boat for that in the healthcare system. Like that is and not me, that's all Julius on our team. But like that is why we are doing more work with providers. That is why we are doing more work with like the maternal health vendors who are doing care management and those kinds of things, because it was way too hard. And because like that doesn't scale in that way.
So these are really great, and we're getting tons of questions coming in, and also about how much they're enjoying this conversation. So thank you so much. Can you be a little bit more clear on your actual business model? There's just a little bit of confusion about are your services free to the families, and if so, where does your actual revenue come from? And then how do you actually decide what determines success, right? Like how do you actually measure your impact?
Yeah, so families don't pay for anything. Though ironically, we've had families who are like, I would pay more for fabric. And I'm like, but you don't pay anything today. And like, so if you are paying anything to anyone, we need to have a conversation. And that like there would never be like a freemium or a like whatever model. Like our families don't owe us a dollar. And never have and never will. We're paid by our customers, right? The health plans, the providers, like the folks who have these shared incentives to have these patients, to have these members, to have this engagement. Like there is a whole lot of money sloshing around in healthcare to tackle this invisible problem of engagement. We're just doing it through things like call centers and mailers. And so we're basically fighting for those budgets of like, hey, you lost X number of members last year, and Fabric grew this way. And like, you missed all 14 of your 14 quality measures last year. Like, do you want to do that again? That was $20 million in like top line for you. And so we're making those arguments and pricing in that way. And like pricing in healthcare is hard, and like we need to continue to evolve because it's much easier. Like healthcare works as provider sees patient, provider bills for patient encounter, insurer in 90 days or whenever it happens receives claim, rejects or approves claim, and pays provider. Like that is essentially how it is set up to work. And so we're confusing and weird. And like that is just a challenge.
Yeah, I can imagine. Thank you for sharing. So a couple great questions have come in about the federal legislation. How do you view the coming changes to represent in either opportunity or challenge for Fabric Health that you're sort of looking into or thinking about?
So it's bad policy, period, by like any way you would cut it, right? Like cost access, like you don't want people to be on Medicaid. There are better ways to get people off Medicaid. Like you do want people to be on Medicaid. Means tested programs like and adding administrative barriers don't actually get people off that you would want to get off. So it's like if you want Medicaid to be only moms and kids, which is traditionally like how Medicaid was thought of, like then just make the program only for moms and kids, right? And get every mom and kid. Like it's bad policy, but that's not the point. Um, that is very much not the point. I think it can be really good business. It just got harder to be poor in this country, which like is astounding to me, but it did. Like it is harder to get and keep and use your healthcare. And like we are only necessary because our system is incredibly broken and because it is so hard to get and keep and use your healthcare. And so like I think it could be great for fabric. I wouldn't, I still wouldn't write the policy, like even if it is great for fabric, because it isn't worth it.
Can I add something to amplify Courtney's point? So I've worked under red state Medicaid agencies and blue state Medicaid agencies, and some of the red state regimes looked a little bit more like the federal legislation coming down.
And
And
I think some of the red states are far more efficient than the
oh,
blue
super
states.
efficient. Like, Texas runs a good Medicaid program, so does
Mhm.
Mississippi. But regardless if it's a blue state or a red state, you have to engage your members, whether it's to verify their income or their work, or it's to get them into primary care. So the politicians come and go, but the need to engage members, which I feel like Fabric does better than anybody else, that's a constant.
This is great. Okay, I have two last questions for you, Courtney. You've just been so phenomenal. What is the future for fabric first in terms of, are you going to expand beyond laundromats, lower income people who have health insurance, other locations? And then I want to know the future for you personally and professionally.
Oh, I mean, I don't think startups really have a business beyond talking next year. And next year I mean as in like 3 months. Because like the time horizon and the pace of change is so fast. Like I had to throw away my 2025 plans. Like they don't make sense anymore, right? Like and they didn't make sense several months ago. And like that's really hard for most organizations and most leaders. Is like most people want to know what next year looks like, much less next week. And I just, you don't have that same, much less in a very, very fluid context. Like we have never, before the ACA, and I think that's like a very different moment in time. This is the most disruptive time in healthcare there has been since like Medicaid was enacted 60 years ago. Like it is pretty crazy. And so you just have to throw most of your plans away. And so I don't know personally or for Fabric, in a long time horizon. And I think it actually like we think about the next quarter, we think about the next 2 quarters, but quite frankly, like I'll do some 26 planning, but it's gonna be wrong. Like there's a little bit of the I think it was like Eisenhower who said it, like there's a value in planning, but like the plan is never right. I totally botched that. But it's like it's an army quote. That there is some just like utility in doing that in that exercise. I will fabric or no fabric tomorrow, like I will continue to solve hard problems because I'm masochistic and enjoy it. And that's like I just I can't put it down. Like I did my summer in big tech during Tuck and I just could not care less about it. I just like I couldn't like it was intellectually interesting, but it just like I didn't care. Um I think we have a public health crisis coming in terms of gambling that is totally self-inflicted, and I think that's going to be fascinating intellectually of how that plays out. But I think, like, listen, we have had to change a lot in this last year. Like, laundromats are far less important. Like, they're the best origin story. It's the best physical distribution channel. But like, we opened our aperture because people were like, there was a Pittsburgh librarian who was literally putting people on Fabric Fam, like saw a local news story about us and just started like found our website and like the member side and just started adding people because he was like, I have people who need help. And like every food bank is like, how many people could I send you tomorrow? And so I actually think it's a really, really great evolution that like the laundromat is really important and it's the nucleus, but like it was never about the laundromat. Like it was always this means to the end. And I think I've always been really agnostic about the path that it takes. Like, if we are making things better, do more of that. Like, if we are building a bigger business that is making more people's lives better, do that. Like, follow that. So, we'll continue to follow the data and we'll continue to have these hypotheses and run experiments and like figure out. I talk a lot about I don't know what I don't know. And like, there's still plenty of that, but like, I don't know. We'll like continue to do this work and see where we find success and like hopefully it really works. And if not, like I will still be proud of what we did.
Yeah,
And I think like
absolutely.
if you can build a startup and you can do that of being like, even if it all went to shit tomorrow, which is startup math, you'll be like, that was worth doing. Like, great.
Yeah.
If not, get a job. It's way easier and you make more money.
I mean, I just have to say, if that's not a great place to stop, I don't know what is. But I do have to say, there's been some great quotes that I want to share back because you are just, I mean, I feel like we could have sound bites and t-shirts made out of this. This is fantastic.
I just
And
have a
everyone
potty
is
mouth.
putting into the chat about how inspirational you are. So just so you know. Okay, a couple of them that I love. I'm not great at staying in lanes. I will continue to solve hard problems. I'm drawn to organized chaos, all of which I think is really inspirational, especially as being an entrepreneur. I have my team's back, really important for leadership. How do you show up for people? These are great questions for us to all ask ourselves. It's hard to be poor and it's hard to use the healthcare in our system. I like solving gnarly challenges. Life looks different for poor families. Muffins before mammograms. I mean, can't you see the t-shirts? Like these are great.
I
And
don't think any of them are great campaign slogans, but they are all very quirky to me.
yes, which I love. And so overall, the point is thank you for this discussion. It's informative, it's inspirational, and I think you've really enlightened many of us on this call today to an area that we're just not understanding as well. So I cannot thank both you and you, Lindsey, for being a part of this, as well as Melania, Meg, and Susie behind the scenes. So thank you so much. We want to just encourage everyone to make sure that if you're interested in continuing this conversation, we are doing a Tuck networking together tomorrow at 4 o'clock. It's just for alumni. You get broken down in a couple of different groups with just 3 or 4 people, and it's just an opportunity to network on this topic. You'll see that link right in the chat. So we encourage you to join that. And then we have one last 125th virtual program on board work in December. So you can find all that information on my talk. Lindsey and Courtney, thank you so much for today. It was so informative and inspirational, and I look forward to hearing all of the future successes of Pembroke Health in the future. So thank you.
Thank you.
Thanks, guys.